My name is Dr. Jacqueline Kitulu. I am a general practitioner in private practice, and I am the chair of Rocket Health, a digital health company, and I also sit on several other health sector boards, the latest being the Kenya Medical Practitioners and Dentists Council. My project is titled KMPDC Talent Development and Succession Planning, building on a mentoring and coaching approach. So what do you see? Very interesting image. Male leaders discussing menstruation, not a single female who experiences the said menstruation. So what is my project about? There is an existing gender disparity within the KMPDC senior leadership, with only about 25% of the senior leaders being female. And this is despite the fact that there are females in the lower levels who can actually ascend to these leadership roles. The council expects to fill 25 vacant positions at senior management level within the new organizational structure. Without deliberate effort to encourage gender equity, this disparity will remain or worsen. And the opportunity in place right now for me and within my initiative is that there's a KMPDC human resource instruments, there's a strategic plan, and all these align with this initiative of gender equity. What do we see again? We see one female now in this image. All these are male leaders of professional health associations. So we have the one token female in leadership. This is the narrative we're trying to change. So why? This process of adopting the new organizational structure and career progression guideline revealed that potential for several of the lower officers to ascend to senior management. Having discussed and interviewed many of these ladies, what has come forward is that many of them feel male leadership is cemented in the institution. And then the other barriers holding them back, and these are universal in most places: childbearing, family commitment, fear of risky senior jobs, excessive responsibility, wanting to remain in the comfort zone, and of course, lack of relevant academic qualifications. All these, in my opinion, are surmountable. And all that's needed is a paradigm shift, a mind shift to make this change. This is the how: mentoring. My project is going to be based on mentoring and all the amazing positive aspects that can come from mentoring. So how will the project look like? The KMPDC mentorship program, and that's going to be my phase 1 within the project, will involve identifying possible mentors, and then each female staff will be linked to a mentor. And at this point, we'll have a mentee choosing a mentor. There'll be monthly mentor-mentee engagements, and then a quarterly mentorship summit with an external speaker. The phase 2 will be the coaching for the senior level managers, and I've put this at phase 2 because of the cost implications. Number 3, and which is not necessarily phase 3, but number 3 is an ongoing skills building, and this will be training for identified gaps. This already is budgeted for within the HR budget, and will seek to ensure that the gaps that have been identified will be the focus. And finally, we have the gender mainstreaming policy implementation, which is a policy initiative being implemented across state corporations and is required for performance on the performance contract for the council. So is gender equity really possible? This image shows the Kenya Medical Association National Executive Council, and indeed gender equity is possible. So outcomes of my study so far: I had an early setback in that my term at the council came to an end. However, the CEO and Deputy Director for Human Resources are all very supportive of this project. One thing being that it doesn't cost them much, but will go a long way into improving their staff. So I've achieved buy-in. The interviewees at all levels were excited about the initiative and that this would be a first of its kind. And they were all unanimous about the need for mentoring, especially from other women, and the areas that popped up were confidence, resilience, and developing others. I've already identified 4 senior female managers and 6 officers who are willing to mentor others with support. The program is ready for kickoff this very quarter. So this is my long-term goal for my project, that we'll have gender equity and the senior leadership at KMPDC. So in closing, WomenLift Health Leadership is by far the most impactful leadership program I have had the privilege to attend. I have re-envisioned my purpose, and it is to mentor and build a pipeline of women in leadership in the health space. So I leverage on my influence, style of inspiration and bridging to ensure that this mentorship project enables me to inspire action and lead change for women leaders at KMPDC. As I am looking at it in developing KMPDC leadership, I am also calling each and every one of you ladies to action, that we may all stand out as leaders who build others. So start a mentorship program in the organization where you are based right now. I will be calling on each and every one of you to be part of my external speakers in the quarterly mentorship seminars, but you can also start that, and I am willing to participate in your program. Asante sana.